Hello guys, today I'll be talking about influenza. Influenza is caused either by influenza A virus or influenza B virus and it affects the respiratory system. It causes variation in hemagglutinin and neuraminidase glycoprotein on the surface of the virus. Minor changes in hemagglutinin is called as genetic drift, whereas switch in hemagglutinin and neuraminidase antigen is called as genetic shift. Now let's discuss the clinical features of a patient with influenza. The incubation period of influenza is 1 to 3 days and it causes fever, cough and malaise. Now let's discuss the detection of influenza virus. Influenza virus is detected by viral culture, RNA detection in reverse transcriptase RT-PCR in a nasopharyngeal sample. Also seroconversion can be used to diagnose influenza virus. Now let's discuss the prevention of influenza virus. All patients of influenza virus are given flu vaccination. The dose of flu vaccination I've discussed already in my previous video. The flu vaccine is given to children in the first year, 2 vaccines 1 month apart after 6 months. Thereafter, 1 vaccine every year for 6 years, till 6 years. And then in old patients with more than 60 years of age, influenza vaccine is given annually. The 2 types of influenza, avian influenza and swine flu influenza. The avian influenza is caused by influenza A virus. The strain is H5N1. Here the influenza virus binds to the respiratory tract epithelium. This is seen predominantly in individuals exposed to poultry in Southeast Asia. Also, it's seen in migratory birds of Europe. The virus transmits person to person. Vaccination is not effective against avian influenza. All patients with avian influenza are given neuraminidase inhibitors, but some strains are resistant to oseltamivir. Now let's discuss swine influenza. Swine influenza is transmitted from pigs to human. Its first outbreak was in Mexico in the year 2009. The strain is H1N1 as we all know, and management of patient of swine influenza is by hand hygiene and proper dissemination of infection during coughing and sneezing. Also, neuraminidase inhibitors like oseltamivir and zanamivir are used to manage swine influenza. Now let's discuss the complications of influenza virus. The complications of influenza virus are pulmonary and non-pulmonary. The pulmonary complications of influenza virus include viral pneumonia due to superinfection with Staph aureus and Streptococcus pneumoniae. The extrapulmonary complications include myositis, pericarditis, myocarditis, and neurological complications like Ray's syndrome, encephalitis, and transverse myelitis.